In phase 1B of its vaccination distribution. Law enforcement now receiving shots. This comes as COVID numbers continue to climb across the country. Here with a look at what is going on in the Garden State, Dr. Shereef Elnahal, President and CEO of University Hospital in Newark. He's also the former New Jersey Health Commissioner. Doctor, thanks for joining us once again here on the Pix Up Morning News. Appreciate you coming back.
Thanks for having me.
So, Doctor, I want to begin with the vaccine rollout from a view of 30,000 feet above, right? The CDC saying 22 million doses distributed nationwide, 8 million administered. When you zero in then on New Jersey, 572,000 distributed with 200,000 administered. Is this a bit of a slow rollout here?
Well, it's slower than we would have hoped, and there are a lot of reasons for that. So first of all, the initial shipments of the Pfizer vaccine were delayed to many states, and that had to put the onus on state health departments to switch out Pfizer stock with Moderna, which is actually what happened at our hospital. And the second thing is that you wouldn't expect the vaccine administration operation to be immediately 100% efficient. There's a ramp up. Everybody's learning this as we go. And while it sounds simple to just, deliver shots in arms, it's actually a little bit more involved than that. You have to observe people. You have to make sure that every dose is tied to an individual reliably, and they have the second dose scheduled. So as we are learning, it's getting faster. And that is the good news. The pace is picking up across the country.
Understood. So let me talk about specifically what's happening at University Hospital. Then more than 150,000 healthcare workers throughout the state of New Jersey have received the first dose of the vaccine. But specifically at University, how far along are you with giving out the second dose?
We've already started second doses for both Pfizer and soon Moderna. It's really just an amazing thing to be able to deliver these second doses and deliver that 95% effectiveness in terms of protection, but also a relatively low side effect profile. And we're excited to be able to do it. We're going to be administering Moderna vaccine second doses very soon. And it's really an amazing thing to be able to offer that protection and peace of mind for our frontline healthcare heroes.
I think when people look at the rollout, right, and I was listening to very carefully what you were saying about learning as you go, and the numbers just seem to be off, right? With that 22 million nationwide and 8 million being administered, it almost seems that some of those doses then are languishing in freezers because some people may be saying, I'm in this group that's eligible, but I don't want it. Are you experiencing that?
We are not experiencing that where we are, but I can tell you it is inexcusable to let these vaccines expire in freezers and in refrigerators. So we do have to pick up the pace. There's really no excuse to allowing that to happen. What I will say is that, yes, while people are picking up the pace, there's definitely a spectrum for folks who are experienced and able to do this well, while there are parts of the country who do not have any experience yet doing this and are slower. And that's where the federal government really needs to step in and help. Nobody wins if people are not being vaccinated at the pace that we want.
Yeah, a lot of states saying we haven't received a vaccine rollout plan from the federal government. Specifically today in New Jersey, law enforcement receiving the vaccine. Do you think distribution of the vaccine in New Jersey is going to make a difference in terms of fighting COVID-19? What is the number here of like herd immunity? You hear that kind of thing thrown out there a lot.
So we're talking about 70 to 80% of the population, hopefully closer to 80%. So we're talking about over 5 million people in the state of New Jersey with an ambitious goal of getting there within 6 months. Now, it's going to be difficult to do that with the pace we have so far. But I do think that especially after January 20th, when I know the federal government will be stepping up and assisting every part of the country with vaccination, that it will really pick up speed. But we're talking about a huge percentage of the population, which will require mass vaccination sites and vaccines available in as many places as possible to deliver safely.
Yeah, we're seeing some of those mass distribution sites open today, specifically in New Jersey as well. There are many concerns also about this new variant and if this is just the beginning of more strains of COVID. I've talked to you about this. I've talked to other doctors. Viruses mutate. That is not unexpected. But will the vaccine fight against these mutations?
Well, that's not entirely clear. There's a lot of optimism that it will still be effective. And the reason is that the mutations don't really alter the structure of the virus in such a way that the antibodies aren't expected to work that you develop against them. And so they are being tested by the companies now. Both Moderna and Pfizer are making sure that they're analyzing how protective it is against these new variants. But all it really does is impresses upon all of us to continue masking, social distancing, but very importantly, to pick up the speed of vaccination so that we can catch up in case one of these mutated variants becomes the dominant strain and spread increases even more.
Understood. And I want to just myth bust a second, right? Number one being you had the vaccine. Many people are saying, well, I don't want it because it's going to make me sick. It's like the flu shot, right? I don't want the flu shot because I'll get the flu. How do you feel?
I feel fine. I've gotten my first dose already. I have my second dose lined up pretty soon. I had a couple of days of arm soreness. Others have told me they have fatigue and some other mild symptoms for 1 to 2 days. But remember, those symptoms are a sign that your immune system is working and responding. The way that you actually feel sick when you are sick is that your immune system is ramping up. So that's actually a good sign.
And lastly, the other myth is, I got the vaccine, I don't have to wear a mask anymore. I don't have to social distance.
Yeah, it's another myth because we need to make sure that 70 to 80% of the population is vaccinated. That's when everybody will be maximally protected. There's still a small risk of getting COVID-19 and importantly, spreading COVID-19, even if you do have the vaccine. So we can't let that happen, and we have to follow all of these restrictions going forward until we get there.
Understood. Dr. Shereef Elnahal, always appreciate you making the time for us here on the Pix 7 More News. You're welcome back anytime. Thank you.
My pleasure.